Welcome everyone to the Zoom meeting. We're going to discuss a couple of topics, but I want to open the floor for any comments, any questions, any ideas before we start. Anyone with any updates for your interviews, your application, letters of recommendation, and so forth. Now we can go to the topics. So here we're gonna talk today about some articles. One of them is brain training in games. So we can share the article and then we can discuss. And I need your help with that. So just tell me what you think and participate with your comments. The next, we will go over improving your network. So also this will be discussion kind of. We'll go over some of the slides, but I need you to share your experience as far as how you increase your networking, because I think it's the season where you need some connections. And last thing, we can go over some of the risk prevention in older adults. So we'll look at that later. So to start with, can I just start with the article? It's the brain training games enhance cognitive function in healthy objects. So I just want to share with you that when you come with ideas, it shouldn't be just focused on clinical aspects. You can write about your own personal experiences and reflect on that, or you can look at what can be done in general. So in this article, the authors were trying to assess and see how can we use brain training games so that we can keep people healthy. So as we go over how to write the abstract or how to write the manuscript, you need to work on your abstract first, your idea. So what you want to look at. So this will identify like area. So here they want to focus on brain training games. So this will be your first sentence. What brain training games? You can use abbreviation for that. And then you want to identify that if there is definition, if there is agreement on what gaming or games. And then you can elaborate on that. See what the background about the topic that you are talking about. So a few sentences, one or two will suffice, will give you the background of gaming. So they are believed to play a major role in improving cognitive function. So later in the introduction, we can elaborate on that with some facts obtained from some articles or some references. So now we are going to the aim. So the current study evaluated if the brain training games showed positive impact on attention memory functions compared with baseline and in healthy visits. So this is basically the idea. They want to use the brain training games, and then they want to see if it can have any positive impact. So in summary, they want to tell you what the material, what the method, so how they did that. So the study started in October 2015 to April 2016, about 1 year. I'm bad with calculation. So October to April, so 6 months maybe. That was done in the Department of Physiology, College of Medicine in Saudi Arabia. So how many subjects? They identified it with one healthy normal subject. So basically volunteers to come to the lab or computer lab where they play with some games. So that game is called Luminosity. It's an exercise game where you will play different small games. Each small game will identify part of the brain or function of the brain. So it will focus on functions like flexibility, memory, attention, speed, and problem solving. So each part of each function will be assessed and will be improved, or when you play, it will focus on that part of the brain cognitive function. So this is how they did the experience experiment, basically. And then they collected the data. So their results, they show that there is some improvement and it's significant. So they will use some statistical analysis to say that it's significant. So between the first time in October until the end of the study in April. So they did start of deadline and they did at the end comparison. So it's gonna be the same group, but two variables. Variable number one is the deadline, and then the same group at the end of the study. The result will be compared to the first findings. And we can use the method most likely we'll use t-test because it's compared two endpoints with the same group in this study, for example. And these are the findings of the variables that they were looking at. They measured certain things. They measured the mean correct latency, for example. They measured attention switching task, cost, and then mean correct latency. All these are variables that they can measure using certain ways or methods to come to these numbers. So when they collect all the information and they analyze this, they found that there is positive correlation between the pattern recognition memory, for example, between these subjects when they use the gaming system. So what they found, basically, an improvement in different cognitive domains, and these domains include the attention, includes memory speed, for example. So these are obvious for them. Then they will come to the limitation. So for the future direction. So when you do a study, you may find that you have some limitations, or you may find that you will have more questions arise from the data. So in this case, they found that the study warrants further research to determine the long-term effects, because their study is only about 6 months or so, 7 month period. So it's a shorter duration. So they want to see if this can be applied to a longer duration or a longer period of time in patients with good cognitive functions. And then they want to see also the same approach with older adults compared to younger adults, or people with good function, cognitive function, versus people with some cognitive deficit and so forth. So this is just an idea. They started with 61 subjects or volunteer, for example, and then they offer them some gaming system where they practice, they play, and then after 6 months they do the questionnaire or collecting the data at the baseline at the end of the study, and then they found there is some significant improvement. So in the future, maybe they can do a longer study, or they can compare young versus adult, or they can compare adults with good function, cognitive function versus adults with some deficit or some mild cognitive impairment, something like that. So this is how they developed the idea and they wrote the abstract. Then when we can go to the full text, when they want to write the manuscript itself, as we can see here, that the background, they will talk about the games and cognitive function and these terms basically. So they talk about cognitive in general, Alzheimer's, dementia, for example, impairment in cognitive process, and so forth. And then for this paragraph, they have a couple of references. So you give a background of what you are talking about, what you are going to test. So they want to test cognitive function, and they want to test people with some dementia in the future. This is the idea, how we can use gaming to prevent the progression from good memory or cognition to status of Alzheimer's, for instance. And then they have another paragraph, two paragraphs about how they can use training games, or how it was used in the past. So they have some references for this as well. And then they have some further studies about specific areas or specific markers like the apple protein. And they have some references for that. So after you already collected the information or references for your background, now you want to prepare the reader for what you are going to study. So in this present study, we assess whether brain training games could improve their cognitive ability, specifically, for example, the ASD, MOD, something like that. And they compare it between baseline in the same healthy group at the end of the study. And they elaborate on what type of assessment they can use. So the reader will know exactly what the goal of the study or the aim of the study and how it's going to be conducted in general. Then the specific will come, the methods, including the material and methods. So the participants, they elaborate on the same where and how many and what time period, so forth. And then you can elaborate on their baseline and they assess their cognitive function using the MMSE, for example. And you can use different methods to assess the cognitive function. And then they elaborate on what the velocity or the brain training application that they are using. So it's a brain app that is available on Google Play or Apple Store, and people can use either Apple or iPhone or any mobile, Android mobile, for example. And they want to see how many, like number of days, number of minutes, the subjects are using the app, for example. Also elaborate about the app, what the features, what aspects it can assess or it can test when you are playing the games. And then again, they elaborate on the MMSE and other type of findings, including the blood essays or markers. After that, they did the assessment, as you said, pre and post, and they analyze using certain software. You can identify, or you can mention which version that you are using, because if you have a newer version, or the reader have a newer version, maybe they will say, oh, we use this version, but it did not give us the same result that you were mentioning, for example. So you want to let them know that you are using certain software and what version of that software. And when you use a software, what methods, statistical methods that you use for analysis. For example, the t-test, you just mentioned that they're going to use a t-test, and here in time they did that. And then they have some other methods for correlation between tests. For example, one of them is human correlation test. And they elaborate on the results, and they will go over some details as far as the usually you start with the demographic level 1. Most of the studies, when you have subjects, you want to let the reader know some characteristic of that population, or that cohort, of that group of subjects, if they are volunteer or if they are patients, for example. So what's the age of this group, or mean age, for example? What's the gender? And in this case, the BMI, for example, that and other findings, including the baseline number of scores. These are two groups, so the active group and then the control group. And then you can elaborate on the findings, or what the results from the analysis, and then you create some figures comparing the performance, for example, in this graph, change in the mean attention switching task, for example. Here in the active group, there's a active group. There are some differences. So some graphs indicating that you show what the findings, and you can also elaborate on some of the findings using tables in this test, for example. This is one more graph and the given correlation, and then they use it again for a different marker, for example. At the end, then you will say my conclusion is so and so. But to say that, you want to re-inform the reader that this is an important topic. So you want to repeat some of the background in your discussion of the conclusion, that you are using this application. It's an important, useful application, and we use it in this certain group of people. We are setting an important aspect of humans, the cognitive. And so our study produced two main findings, for example. So then you can elaborate on some details of your findings. So you can elaborate, say, this program or this software we have helpful in this area of the brain function, something like that. So this is where they want to elaborate and discuss more what they found, what the importance of their findings. Then at the end, they will conclude what with one or two sentences, want to summarize basically what you found in the study. Sometimes you can mention the limitation in a different paragraph or different setting, but you can mention it as a conclusion as well. And then you can elaborate, or you can discuss what's the possibility in the future, what can be done in next phase. So usually when you do a study, you will come with a prepared question and you do the study, for example, this one. After you are done with analysis and so forth, you will find some areas that you want to investigate more. These are the future and directions that more or less you will mention in your conclusion, that we found this, but we also want to study, we want to study more of this. For example, they limit the study in Saudi Arabia. Now we want to apply the same study in Europe or in Africa or in Asia. We studied people in their 50s. Now we want to study people in their 60s. Something that we want to study more, further studies, for example, further research that can help you identify areas for improvement or identify areas for intervention and so forth. So basically, the conclusion will give you opportunity to ask more questions for the future studies that you plan to conduct, for example. And then if you have any funding, for example, this was funded by the university, you will mention who funded the project or the study, and if there is a number, they can contact the university and ask about this study number funding, and they will find exactly how much they pay to you, for example. That's to limit the role of funders or people who can fund, or companies that fund similar studies. So if the study is funded by university, the company that created or developed the app, and you are saying, because of your study of your article, that the study is very, very significantly improving the health and well-being of people with cognitive impairment, for example, mind, then that might be supported from your side to get money from that company, or the company paid you to do the study so that you show that it's working, so people can buy that app. So this is the importance of the you want to share the source of your support. So when I read, I can figure out if this is biased because the support is coming from the company that developed the app that you are using, or it's not because it's just supported from the government or in this case from the institutions. And then you can put your references. Sometimes if you go to the authors, sometimes the journal will ask you what the contribution for each author. So for example, the first one might come with the idea. So I'm the first author, I came with this research question, the research idea, and then I collect all these collaborators, create the team, and then identify each team member to use or to work on certain tasks. So maybe this person will focus on getting the subjects. This person will work on analyzing. The two others will work on the data analysis. For example, they have experience or they have access to the software. And the last two will work on the draft, for example. Mostly, the last one will be a senior. Sometimes will be the one who oversee the project, or will help if there is any questions that is expertise of one is more knowledge, more experience in the field. So most of the time, there will be senior author, for example. So if you want to look at the affiliation for each one of these authors, you can click on the author and it will show you the name institution. Sometimes they can be working in different institutions. Most of the time, the first author will be also the corresponding author, but not necessarily. Any one of them can be the corresponding author. So this will indicate which affiliation, which institutions, universities or so for each of these authors. And it will show you the author role of writing this paper. So G, for example, which one is the
Dr. Nader?
Yes.
Assalamu alaikum. We are the presenting group today.
Okay.
And yeah, so if you would like, we can start, if that's okay.
Please. Thank you so much. I appreciate it.
Absolutely. Let me share my.
Go ahead.
Yes, I'm just going to share my
Go ahead.
my screen with everyone.
Thank you.
And all right, is it clear?
Yeah.
All right. So my name is Eiman Ahmed, and I'm going to be presenting the brain training games that you just went through. So thank you so much for the very intense, I'll say, introduction. So the objective is, why do we usually do these games? So what are we trying to get into here? So managing age-related decrease of cognitive function is an important public health challenge, especially in the context of the global aging of the population. Given that increasing aging is associated with a natural decline in cognitive function, identifying effective interventions that can help to prevent cognitive decline is older adults is a research priority. So what kind of cognitive changes do we see with normal aging, so we can implement things to change that? So first we see memory. In the memory, there's effect in memory, especially with our big friend dementia, is one of the leading causes of disability. It's an estimated that 50 million adults live with the disease worldwide. The second thing we see in aging is executive cognitive function. So when you age, you have troubles involving decision-making, problem-solving, planning and sequencing of responses, and multitasking. We also see a change in speech, especially in speech comprehension, in the setting of background noise and ambiguous speech content decline with age. Also, older adults were less verbose, more repetitive, and less specific in word choices in spontaneous speech when compared to young adults. We also see a decline in speed attention. I just want to make a note here that cumulative knowledge and experience skills are well maintained into advanced age. Looking into the paper that we have just discussed in regards to the brain training games, enhance cognitive function in healthy subjects. So this is a study that was done in Saudi Arabia, in the Department of Physiology, the College of Medicine in King Saud University and in King Khalid University between October 25th until April 2016. So they were trying to evaluate the brain training games showed impact on attention and memory function compared with baseline visit in healthy subjects. So these subjects were not sick at all. They were healthy subjects. So normal healthy subject to use a computerized cognitive training game, Lumosity. So the range of cognitive function, they were looking into the range of cognitive function. They were looking into attention, processing speeds, visual memory, an executive function of about 15 minutes per day, at least for 7 days per week for 3 weeks. So the control, or the N, was 21. Group did not perform the training. So they took serum samples where they used to study the brain deliberative growth factor, the BDNF, and the apolipoprotein E and ApoE levels. So the results show that there's a significant improvement in luminosity performance index was observed in active group compared to control group by the end of the training. Their p-value was 0.01. After the training, a statistically significant difference is most of cannabis measures. Also, a positive correlation between pattern recognition memory and ApoE was found in people who had higher ApoE levels, had a faster response. So the conclusion is an improvement in different cognitive domain was noted, including attention and motor speed. However, the study warrants further research to determine the long-term on other cognitive functions. Since it was only a 6-month study, so they were trying to look into what's the long effect of the cognitive function in different groups, the elderly versus adults. Other brain training games that I would like to talk to about is the cognitive mobile games, especially with the COVID. There was a lot of cognitive mobile games going, training games to help elderly in different levels. So they were targeting memory sweep, word pairing, and bubble boats. So what we mean by memory sweep is to memorize the position of the licensed title and remember their position when gone. So this helped a lot with the memory, of course. There was also word pairing, where they pair words accordingly to a specific rule presented, similar opposites, and that helped a lot with attention, spiral memory, and working memory. They also worked on a bubble boats where it creates the maximum number of words of at least 3 letters with the 6 available letters. And that helped a lot with the word fluency and vocabulary. Other games that also help improve the brain were popular puzzle games can engender improvement in attention and visual tactile ability compared to playing the brain training games. Also, commercial brain training games improve executive function, working memory, and processing speed in younger adults. Thank you so much.
Thank you so much, Dr. Eiman.
Thank you so much. If everybody has any question, I'm ready to answer, of course.
Any questions for Dr. Eiman?
All right, I think my next colleague is ready to present if we don't have any other questions. Thank you so much.
Assalamu alaikum. Thank you, Dr. Eiman, for night. My name is Sharifa Mohieldin. I'm going to present the next. Let me share my screen. Can you see my screen?
Okay.
Okay. Clear?
Not yet.
Today, I'm going to present important tips in building good networking. Here we have 10 ways to improve your network. Okay. Can you see it now?
Yeah, thank you.
Thank you. Okay. Much of businesses opportunities are about making connections. To build your pipeline and reach potential new clients and business you wouldn't normally get access to, it's essential to always be expanding your network. Here are some tips to help you improve your networking skills. Take a close look at the network and the resources that you already have in place. Do not overlook the hidden potential that is all around you. Creating new opportunities from pre-existing ones is the most elemental of networking skills. You can network anywhere with anyone. When looking for organizations to join to help you build your relationships and connections, choose groups where you can make a contribution and will be interested in what is going on. Communicating your message is a means of gaining credibility that is best accomplished through substance, not style. Listening and asking questions helps you build rapport and trust. Practice your communication until you feel confident that your message will come across as genuine and unscripted. Most of us cannot just show up at events, stand around, and expect people to come up to talk to us. Be proactive and start conversation with others. This doesn't mean you have to be the center of attention and the life of the party. Simply be yourself and the rest will fall into place. Keep the conversation fresh and interesting. Balance the amount that you talk with the amount the other person is talking and ask open-ended questions. Exit quickly from conversations that aren't good matches. When you find good conversation with people who could be the right fit, don't be too quick to leave. A few rich conversations and good new connections can make for a very successful event. When it comes to networking, knowing what not to do is as important as knowing what to do. No matter which method you choose, follow-up is crucial to your networking effort. Follow-up turn a casual connect made at meeting, party, or event into a potential long-term relationship. In the end, networking is all about building relationships that are honest, sincere, and value of both parties. As you work to stay in touch, try to develop relationships that benefit the other party as much as they do you. Build relationships for the long term. The best part about building relationships is that whatever you put in comes back to you. More and better relationships mean a greater likelihood of generating leads that you can convert into great opportunities for your business. Thank you. Thank you for listening.
Thank you so much.
Thank you.
Thanks again. Any questions or any addition or any it's opportunity for you to share your experience or your input?
question I can present? Hello, everyone. Can you see my right now?
Yes, we can.
Yeah.
Okay. This is Abdullah Al-Hadi. Hello, everyone. Today I will present my PowerPoint about prevention in geriatric. As we know, the prevention is important than treatment. Prevention have multiple aspects. We talk today about prevention of the disease in the elderly and prevention of reality and prevention of injuries for elderly and prevention of the heterogenic complication in the elderly and psychological problem. So the benefit of the prevention, even in every elderly, preventive intervention can limit disease and disabilities. I will talk about the prevention categories. The prevention categories is have three categories: primary, secondary, and tertiary categories. Sorry. The goals of care for elder adults. Life expectancy is the most important thing to do before prioritizing recommendation and making decision. There is short-term goal, concern about symptoms management and care coordination, personal safety, evaluate living situation, and mind the range about preventive care, disease management, psychological issues, coping strategies. So, as we say, prevention is more important than treatment. There is overview of prevention for older adults about healthy living, exercise, diet and weight loss, smoking, counseling, alcohol use, and recommended screening and immunization for adults. Uh, as I mentioned, primary prevention is about uh, prevent the disease from occurring, like improve the lifestyle, like doing exercise, stop smoking, quiet alcohol, and we talk about the exercise benefit, how the exercise can reduce the all causes of the mortality and also cardiovascular diseases and risk for hypertension, diabetes, and adverse blood lipid profile. Also have major role in decrease the risk of multiple cancer like bladder, breast, colon, endometrium, esophagus, and others. Also have important role in decreasing the dementia and falls and fall-related injuries. Also decrease the anxiety and risk of depression. Another side have improved the cognition cognitive function, quality of life, sleeping, weight management, and weight loss when combined with calorie restrictions, and bone health and physical function. About alcohol, assessment for alcohol abuse, there is about 50% of adults of 65 years old consume alcohol. There is 14.5% of these drink more than 7 drinks a week or may binge drink. There is CAG questions, cage question. Have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Have you ever taken a drink first thing in the morning, eye opener, to steady your nerves or get rid of hangover? Two positives, 77% sensitive and 79 specific for alcohol abuse and dependence, but only 53% and 70% respectively for unhealthy alcohol use. Second type of prevention, that's secondary prevention. An example, immunization for adults, like influenza vaccine, pneumococcal vaccine, herpes zoster vaccine, COVID-19 recommended boosters. Herpes zoster vaccine recommended for immunocompetent individual above 50 years old, strongly recommended if more than 60 years old. The preferred vaccine is recombinant zoster vaccine, Shingrix, 2 shots from 2 to 6 months apart. Immunocompromised patient may also receive the vaccination over the 19 years old. Tetanus or pertussis. Pertussis, that called whooping cough with tetanus vaccine, TB, every 10 years. Vaccination against pertussis is important for adults who have close contact with infant less than 1 year. TDAB should be administered regardless of the interval since last dose. Cancer screening. The decision to offer cancer screening to older patients require the provider to assess risk benefit on an individual basis, particularly to the more senior patients. There is cancer screening for prostate, colorectal cancer, breast cancer, cervical cancer, and lung cancer. Prostate cancer, prostate screening is recommended for men who is old from 50 to 69 years old, and the screening stop when there is patient life expectancy less than 10 years. Colorectal cancer screening, initiate screening at age of 45 and through age 75, as long as their life expectancy more than 10 years. So not recommended for of above than 80 years old, because risk of prevention, perforation, and so breast cancer screening, as we seen up to date. Okay. Cervical cancer screening, lung cancer screening. Lung cancer screening by low dose chest CT scan annually. There is recommendation is underused. It has been estimated that only 15% of eligible patients have had this done. Benefit, the national lung screening trial resulted in a relative mortality reduction of 20% and an absolute reduction of 62 lung cancer death per 100,000 years. Who is eligible? For those who have high risk individual age between 50 and 80, who smoke 20 back years history, either current smoker or former smoker who have quit within the last 15 years to be discounted when a person has not smoked for 15 years or life expectancy is limited. Other health screening recommendation: diabetes, lipid screening, abdominal aortic aneurysm, regular blood pressure screening. Diabetes in patients who be aged from 40 to 70 with body mass index more than 25 kilogram per meter square, and patients with hypertension and hyperlipidemia. Lipid screening about LDL and cholesterol and lipid profile. Abdominal aortic aneurysm indicated one time for men in age who 65 to 75 who ever smoked, have ever smoked, or had first degree relative with abdominal aortic aneurysm, and for women with a strong family history. Regular blood screening prevalence, there is 70% among patients over 60 years old and 82% for above 75 years old. As we know, hypertension, if it is above one, it is equal or above 130 millimeter mercury systolic, or and more than 80 millimeter mercury for diastolic. One report has found that there is 90% lifetime risk for developing mild hypertension and 40% lifetime risk for severe hypertension who have normal blood pressure at age 55 years old. Thank you. I want to speak a little bit about other aspects of the prevention. Now, after we speak about prevention of disease in elderly, we want to make a note about prevention of iatrogenic complication in the elderly. Principle of prescribing for an elder patient: start with low dose, titrate upward slowly as tolerated by patient, avoid starting two drugs at the same time, review the over-the-counter drug like antihistamine with antidepressant, maybe raise the risk for fall, medication reconciliation, and renal hepatic function tests. Also, about prevention in injuries of the elderly, about the falls and home hazard and driving hazard. About the prevention of psychological problem, do the minimum stage screening and mini cognitive screening. Thank you so much. If you have any question. Sorry, I want to add something about the type of prevention intervention. As we mentioned, it's primary, secondary, and tertiary. Primary, that about prevention of disease like lifestyle modification, immunization, chemoprophylaxis. Secondary prevention, that's for early detection of the disease before it's become symptomatic, like doing screening, as we mentioned. Tertiary prevention refer to activities that optimize health once disease is already detected, right? Rehabilitation. And so thank you so much. Dr. Khansa, do you hear us?
Hello.
If it's
Hello.
available, you can.
Assalamu alaikum. Assalamu alaikum. Can anybody hear me?
Yeah, we hear you.
أيوة صوتك واضح.
So just give me a little bit. I want to share my screen. So today I'm going to be presenting finding funding opportunities and creating timelines. So, okay, what is funding? It's an award to provide or support proposal project. This typically in form of grant, which varies according to the purpose and target of the audience. So why we should apply for funding at a graduate stage? For experience, get your snowball started, and extra funding and prestige. So funding resources. About funding resources, they are identifiable and accounted to ensure that the project is adequately funded so that the fund committed to the purpose that they were made it for, like federal, foundation, state, local, professional associations, business, or industry. So the U.S. National Science Foundations offers usually hundreds of funding opportunities, including grant, cooperative agreements, and fellowships that support research and education. There's different types of opportunities for which you should be searching, like new graduate student fellowship, travel funding, research funding, dissertation funding, awards and conferences, postdoctoral fellowships, awards, scholarships, local foundation, and business. Okay, first 3 years of graduate school, there is a new graduate student fellowship, NGFs. They provide financial support to graduate students to pursue graduate studies without associated teaching or research responsibilities. They're characterized by early stipend, tuition fees, and health insurance coverage, possibly international travel funding. There's some common agencies like the Ford Foundation, NCF, and Hertz. So in order to prepare, you must apply for the NSF during the first couple of months of graduate school. Prepare short essays, 1 to 3 months of editing, letter of reference, and new graduate student prestigious fellowship workshops. Throughout graduate school, there is travel funding, research funding, grants, and awards and conferences. Funding for these needs is available through both external and internal resources. So also in order to prepare, they needed a minimum of 3 months. Join professional associations immediately. Familiarize yourself with the department, endowment, grants, and the graduate school. And the application procedures vary. Sorry. Throughout graduate school, there is internship, research assistantship, and teaching assistantship. Funding for these needs is available through both internal and external resources. Also, to prepare for research assistantship and teaching assistantship, you should check with your department, go through the list of opportunities on the graduate school website, check with the department that you receive great grades as undergraduate. For internship, you should check for external and internal resources. Dissertation funding. There's different types of dissertation: dissertation planning, dissertation research, dissertation writing, and a mix of them. Preparations. We should prepare a letter of reference, lengthy to 20+ page, single space proposals, 6 pages of references, and approved budget. For the postdoctoral fellowship, it's similar to the graduate student fellowship, except that there are more subject specific. Preparations, also we need a minimum of 3 months, curriculum vitae, and short summary of research interest, and letter of reference. Throughout your career as a graduate student, there are many prestigious scholarships like the Fulbright, Boring, and Rhodes, and they are characterized by a student to live in another country, teach, do research, or even learn another language. Using research results to create a timeline based on the amount it takes to apply and funding deadlines for the opportunities for which you are qualified. Also creating an Excel sheet with the top of the title and brief intro, eligibility, phase, and purpose, and how to apply to the website, address, and the annual deadlines. Thank you. Is there any question?
Like that. Thank you so much for the presentation.
Thank you. Thank you, Dr. Nader.
Any other speaker? Thank you all the presenters from today. I'd like to thank you all and great presentation, great work. So we can move on to the next section. Any updates?
Hello.
Hello, hey, Dr. Faida, how are you?
I'm good. How are you, Dr. Nader?
Excellent.
Actually, I do have a project update that I would like to share with everyone, if it's possible.
Yes, yes. Thank you.
Okay. So I'm going to share my screen.
Yeah.
Okay. Is it clear now? Like, is it visible, the screen?
Yeah.
Okay. So we do have this systematic review that we worked in along with my team. It's the neurocognitive implications of COVID-19. We also focus on the pathophysiology, so I would like to present it. At the beginning, I would like to thank all the team members, and also I would like to thank Dr. Nadir for giving us this opportunity and for constantly supporting and guiding us. So we wrote the abstract and we already submitted to the annual American Academy of Neurology meeting. So to begin with, we all know that like the COVID-19 infection has been affecting millions globally. And currently we're experiencing what's known as the long COVID, which is, or the post-COVID syndrome, which is, a condition that's affecting most of the body parts. And looking at the brain specifically, it has been recently found that it does have some cognitive implications. And those cognitive implications actually do result consequently in, clinical challenges, and also they do have a psychosocial burdens. So the objective of this study, it was aimed to look at the available evidence that collected, with regards to the neurocognitive symptoms that's observed in the COVID-19 patients during and after the acute infections, and also to determine the pattern of occurrence of those symptoms. Specifically, this study was meant to focus on the pathophysiological mechanisms behind those symptoms, and to assess the correlation between the severity of the infections and those neurocognitive implications. Looking at the methodology of this study, this was a systematic review that followed the preferred reporting items for systematic review and meta-analysis, or the PRISMA guidelines, during which a comprehensive search in the electronic databases using Google Scholar and PubMed for the years 2020 to 2023, it was conducted by 6 investigators using mesh search that included the keywords. During this study, we included studies that mainly written in English. It also focused on the adult population above 18 years, who specifically exhibited neurocognitive health impacts following the COVID-19 infection. And those neurocognitive impacts were assessed using the neurological physical examinations and specific cognitive tests, such as the mini mental status exam, Monterial cognitive test, and others. Also, we considered the studies that evaluated the pathophysiological effects, or how does the COVID-19 infection causes those neurocognitive presentations, and also later on to as a risk of bias assessment, use the CASP and the GPI checklists. And then data analysis was conducted by the investigators manually. Looking at the results of this study, after applying the filtration at the beginning, 435 studies were yielded, and then after the risk of bias and everything, 111 studies were included in the final analysis. Mainly those that they investigated, as I mentioned, the COVID-19 and its pathophysiology. So we found that several neurocognitive symptoms were reported, mainly most commonly being the having executive dysfunction, followed by memory loss, attention deficit, fatigue, anxiety, delirium, and delay in the processing speed. Other symptoms were also noted, such as the brain fog, the other cognitive symptoms. If we look at the pathophysiological mechanisms behind the cognitive implication, it's yet to be fully understood. However, the evidence that's present currently reflects that the virus can cause the damage through various mechanisms. It mainly approaches the CNS or enters the CNS via either the olfactory nerve or through breaking the vascular endothelial cells that constitute the blood-brain barrier, or through using immune cells. And all of those mechanisms thus breach the blood-brain barrier. It usually binds to the ACE receptors to affect those cells. And once the virus is in the brain, it can cause damage either directly or indirectly, as I mentioned, through various mechanisms. The direct effect is usually through the virus replication within the neuronal cells and the astrocytes. And also within this study, we found that there is no single pathophysiological mechanisms that causes the damage. It's a bit of this and this, combining them together is what's caused the neurocognitive implications. So if we looked at the pathophysiology further, we found that the immune-related inflammations involving the cytokines IL-6, TNF-alpha, interleukin 1b, which are all known to be some way somehow affecting the cognition in other infections rather than the COVID-19 infection itself. Also, the immune dysregulation that happens with the COVID are all responsible for the damage. Also, they found that there are vascular changes in a form of an ischemic changes. Also, the presence of low oxygen tension in COVID-19 patients, coinciding with the other systemic involvement, such as the pulmonary and everything, brain hypermetabolism, and all of this also can impact the neurotransmitter balance and the presence of the oxidative stress during the acute infections. And also later on, they found that also there is an amyloid deposit in those neurons or those glial cells also that's present in the patients who are affected. And this is some way somehow similar to other type of dementias, such as Alzheimer's disease that does have the amyloid deposits. So the combination of all these mechanisms is responsible for the neurocognitive implications. Also, interestingly, we found that actually the presence of a severe pulmonary disease is some way somehow correlates with the presence of those neurocognitive symptoms or presentations. And some of the patients also had psychiatric symptoms such as anxiety and depression. We also encountered studies that emphasize on the role of neuroimaging or nuclear imaging or neuroimaging that include the PET scans in understanding the patterns of affections of the brain areas that's kind of responsible for cognitions on those who are affected by the COVID-19 infection. So to sum up, COVID-19, neurocognitive implications are well documented in the literature. There are a lot of literatures that has talked about the different patterns of affections. Although there are so many hypotheses that has been made and published in the literature regarding the pathophysiology of these affections, but more data regarding this exact impact and the exact pathophysiological mechanisms leading to those implications is required. Also, we recommended that the use of validated cognitive tests before the infections and after the infections, like having as a baseline cognitive test, and then after the infections too, those would help in measuring the exact impact of the of the implications. And thank you. So this is it for all. Again, thank you, Dr. Nader, for constantly supporting us and providing us with such opportunities.
Thank you so much for sharing and presenting your project. That's excellent, and I wish you all the best. Good luck. When do we hear from them?
Thank you very much, Dr. Nader. So the American Academy of Neurology, probably we're gonna hear from them by January, and the presentation, if God's will, it's gonna be on April.
Excellent.
Thank you very much.
Good job.
Thank you very much, Dr. Nader.
You're welcome. Thanks for sharing.
Thank you.
You're welcome. Any other updates or anyone wants to share their projects? We will be presenting one poster in Vancouver and another poster in California, San Francisco, I think, in the coming 1 or 2 weeks. So I wish you all the best there. And congratulations to the team. I think 2 teams published 2 articles in Curious. So congratulations. That's great.
Thank you, Dr. Nader. Yes, we are one of the team. The article titled Atrial Fibrillation and its Association with Cancer. It took a while due to our busy schedule, but thankfully got published this week.
That's good. Excellent. Thank you so much. Congratulations to you and your team.
Thank you.
Anyone else? Ideas? So for the new fellows who joined recently, so we work as teams for each project, and we submit this project in the form of abstracts to some of the conferences or manuscripts to some of the journals. So we have recently submitted to abstracts, and both of them are accepted. They will be presented, and also 2 manuscripts were accepted at like the journal Curious. So congratulations to all the team. Any other updates or ideas? Any questions or any suggestions? Tanya, please go ahead.
Assalamu alaikum, Dr. Nader.
Alaikum salam wa rahmatullah.
Thank you for giving me a chance. I would like to ask a question. Is it possible if Dr. Dara can share with us the results of their paper? It's a very interesting topic, actually, talking about mitral valve disease and its relation with cancer. So if she can share with us those information or the results, is that possible?
Yes, sure, I can share it. I'm not sure if I can share my screen, but I can just summarize the results we had.
Yeah, that would be great. Thank you.
So we found many interesting results, but most of them we found the first thing we found is that the relationship between both atrial fibrillation and cancer is actually bidirectional. The atrial fibrillation can lead to cancer, and cancer of all types can lead to atrial fibrillation as well. What was interesting is that we found that the increased cancer risk was in the first 3 months of atrial fibrillation diagnosis, and also increased atrial fibrillation risk was in the first 3 months of cancer diagnosis. Of course, we still don't know what exactly the mechanism of this association, but it was mostly regarded to chronic inflammation or the medications used in chemotherapy and the medications used in atrial fibrillation. And from these medications, amiodarone was the most medication with with the higher risk. This is just a summary. If you guys want to, I'll share the link to the whole article in the group, inshallah.
Thank you very much. I would appreciate that. Is there any specific cancers that you guys encountered during your study, or it's just as you mentioned, any cancer?
We spoke of different cancers specifically, mostly colon cancer, colorectal cancer, but we covered almost all cancers as well.
Thank you, Dr. Daw.
You're welcome.
And
Thank you so
congratulations
much.
again on your paper
Thank you.
publication. Thank you.
Thank you. I appreciate it.
Thank you so much, Dr. Daw, for sharing. And again, congratulations to you and your team. Any other questions? Anyone wants to share if they have interview news? Any invitation to any of you guys? Those who applied.
Hello, Dr. Nader, again.
Hello, yeah, please.
I actually did, I applied for neurology and I received around 5 interviews from different programs until now. Thank you very much, Dr. Nader, for guiding us and, preparing us for the residency and everything.
Excellent. Thank you so much for sharing, and congratulations. Good luck with all this invitation.
Thank you very much.
Anybody else? Thank you, everyone, for sharing. Any questions, any comments, any questions about this program or any other ideas? That's it.
Hello, Dr. Nader. Assalamu alaikum.
Hello.
I'm the primary part of the purple team, and I want to share about what's going on through the season. Currently, I applied for internal medicine and neurology, and until now I received 4 interviews. And thank you for your support and guidance throughout the season and throughout this fellowship.
Thank you. Good luck. Thanks for sharing. Congratulations for the invitation, and good luck with all the interviews.
Thank you, Dr. Nader.
Hello, go ahead.
Hello, Dr. Nader, and I applied for internal medicine and family medicine for this year, and so far I've received 2 interviews in internal medicine. One of them is actually a pre-match program, so I actually wanted to firstly thank you so much for all your guidance throughout the fellowship, and it definitely helped me out a lot while during the application cycle, and even now. Secondly, I wanted to ask if you have any advice as to how should I approach the pre-match interview?
First of all, I'd like to congratulate you for this invitation and opportunity. So, as far as interview goes, I think if you are interested in that program, and just be enthusiastic and share with them that you are interested in the program. And the same goes for other programs. You will just contact yourself, answer the question as honestly as possible. elaborate and use technography, stuff like your body language, your smile, your answers, so that you can lead them to, for example, more questions in the area that you want to share more information. If they ask you, for example, about this fellowship, you can talk more about it. And if you have some projects, you can also direct them to these projects, so that projects, so they can ask you more questions in these areas where you can just sell yourself. So I wish you all the best.
Okay, thank you so much, Doctor.
Thank you. Any other things that people want to share? Go ahead.
Hello, Dr. Nader. This is Ali Mitwali. I am from the verbal team. I applied for family medicine, internal medicine, and transitional year. I received 3 from family medicine and 1 from transitional. My questions: how to approach the question if they ask me why you're interested in transitional medicine, and you are like, my recommendation letter was from family and internal medicine during the interview.
So usually the transitional year is when you have a spot where you, let's say, you've been accepted to neurology program that they don't offer the first year. So they want you to do the first year somewhere where they offer the transitional year. That's my understanding, and that's the way I went in the past. But for you, I think if they raise this question, and I don't anticipate that. So if they don't ask, that's going good. But in case they ask you the question why you want to do the transition year, what's your background? What did you do, like as part of your experience?
Yeah, what I did, it was primary care. I did some surgery, some emergency medicine, and the rotation was the US rotation was internal medicine and family medicine.
So I'll answer the question if they ask you that. What your answer should at least be most likely 3 parts. Part 1 will be you talk about your past experience, not in the US or overseas. So you will mention that I have good experience in these areas, in the medicine or the surgery, for example. And when I came to the US, I had the exposure to both family medicine and internal medicine. So you will highlight what your strengths, what your background, and then in the middle, you will mention that my thinking at this time, or my goal at this time, is to pursue a career where, let's say, we want to help in our program, for example, on the other. So you will say, my interest in helping all the others. So I haven't decided yet which direction should I go. And if when I get accepted in your program, I will have plenty of time to decide. Then you can say my future will be either to continue as intermediate if they offer some of the program offers, let's say intermediate in the institution or programs network. Or you can say I can have my final decision during this year. So it will be something on the go, still I'm thinking about. So you don't commit to one way or another for them because literally you don't have an acceptance in, let's say, international especially. So you just be honest with them and you just divide your answer to some formal, like 3 parts or 2 parts, so that they can get.
Can I say?
Yeah.
Can I say for them it would be a great opportunity for me to gain experience, clinical experience in different aspects, which will help me to
Sure, yeah, sure. And that's, I think, the reason they did the transition year, because some of the medical students here, they, by finishing the medical school, they didn't reach the decision as far as which direction they will go. So for them, they will spend 1 year. So at least during this way, 1 year, they can decide what direction they will go. So there is no problem mentioning that.
Okay, thank you for guidance.
You're welcome and good luck. Wish you all the best.
Thank you.
Anyone else? Any updates as far as development or new ideas of progression? Right. So I'd like to thank all the presenters from today's meeting and great presentations, and I'd like to thank all the attendees. Thank you so much, and also I'd like to thank those who will watch the recording later. I wish you all the best, all of you. Again, let me know if I can do help. Shoot me an email, send me a message or call. Thank you. I'm trying my best to help you guys. I wish you all the best again. Have a wonderful night. See you next week. Have a wonderful day, wherever you are. Assalamu alaikum.
Thank you, Dr. Nadir. Thank you, Dr. Nadir.
Thank you so much.
Thank you,
Dr. Nadir.
Thank you so much, Dr. Mohamed.
Have a good day. Thank you.